Hello everyone, welcome to my brand new YouTube channel. I'm Dr. Marwa Casey. I'm a neurologist and MS specialist, and I practice out of Cedars-Sinai in Los Angeles. Like I just said, this is a brand new YouTube channel. I am new to YouTube, so this is not the place to come if you want fancy editing. We're doing this first take, only take, straight through, so bear with me. A few things. So I said I work at Cedars-Sinai. Nothing in here has anything to do with Cedars. They haven't approved this. They have nothing to do with producing it. This is all my information, my opinion. Also, it is not medical advice. I am not your doctor. If you'd like me to be, the phone number is in my Instagram bio under the call button. So my Instagram handle is @themsmd. You can find me there. That's the THEMSMD. Even if I am your doctor, this is not the place to get direct medical advice about your care, right? So the best person to talk to is your doctor, but this is some informational, entertainment kind of stuff. So we're going to talk about MS related things on this channel in addition to neurology related things here. So I hope you have fun and find this useful. We're gonna dive in today straight into heavy immunology, but we need to do that to answer one of the most common questions I'm getting these days from my patients, which is, okay, Dr. Casey, I got the COVID vaccine, we talked about it, I feel good, I did it, but how do we know that it worked? How do we know whether my MS or my MS medication affected it? This video is not for you if you have a normal immune system, meaning you're an adult who's never been on immune suppressing medications or immune modulating medications in the past, you're not on them now, and you don't qualify for an AARP membership, right? You're not getting towards the age where our immune system starts to calm down and not protect us as well. So if you're in the young to middle age group, you have no immune issues, have been on no immune medications, we pretty much know your COVID vaccine worked and you can just stop watching this right now. But for those of you who have MS or an autoimmune disease and you're on medications, and the ones I'm specifically going to dive into today are the anti-CD20 medications. So that's Rituxan, also known as rituximab, Ocrevus, also known as ocrelizumab, and Kesimpta, known as ofatumumab. Those are the three that we use in the MS world, the latter two being FDA approved, the first one we use off-label and have been for a long time. So if you're on any of those medications, this video really is for you because we're going to get into the nitty-gritty here today with 3 papers, hot off the presses, hot. They just were published. I mean, one of them literally says November 2021 is the publication date, so we are ahead of the curve. And they all look at a response to the COVID vaccine in people who have MS and are on the anti-CD20 therapies that I just mentioned. And the reason this is important to understand is threefold. One, we're using these medications a lot. They have a nice balance of safety, efficacy, and convenience for our patients. So they're becoming some of the most, if not the most, prescribed meds for MS these days. 2, we know people on these medications are more vulnerable to COVID. So should they catch it, one study showed that they have a 4 times higher risk of hospitalization. And 3, we know these medications, even before COVID, affect someone's response to new vaccines. They thankfully don't erase our knowledge of old vaccines, old infections we've seen. They leave all that intact, but they do take out a tiny part of the immune system that can be important for forming response to new vaccinations. So they do weaken that. We already knew this. There have been studies on vaccines like the flu vaccine, for example, that show that Ocrevus weakens somebody's response if they get that vaccine after they start Ocrevus. So for that reason, I recommend to a lot of my patients that if we're going to start these medications new, they haven't been on them before, I want them to get every vaccine that they need before we start, because that's when we're most likely to have the best effect and get the most bang for our buck from the vaccines. Now, I want to make it clear that I'm not talking about safety here, especially with dead vaccines, inactivated vaccines, which the COVID vaccines are, the flu vaccines are these days. We're not talking about safety. You could get, the flu vaccine and your Ocrevus on the same day and be perfectly fine. The question is, will it do anything? Will it work? And that's where we get into this discussion. So let's dive into it. Like I said, 3 papers here. These are all 3 I checked open access. So I am not giving you any information that you can't go and read yourself. I'm just digesting it for you. And on the same note, this isn't any proprietary or restricted information. It's not behind a paywall. Literally, you can Google any of these papers. If I can figure it out, I'm going to put the information for all 3 in the label, title, whatever you call it, of this video, so you can read them for yourself if you want. You can look at the figures in more detail. Those are usually the ways to get the distilled information from the study. So in no real particular order, we're going to start with this paper. This was published in Multiple Sclerosis and Related Disorders, a fantastic journal. I believe this is the one that was listed as November 2021. Oh, no, this one is September 2021. So anyway, brand new information. The lead author on this is Frederik Novak, and the title is Humoral Immune Response Following SARS-CoV-2 mRNA Vaccination Concomitant to Anti-CD20 Therapy in MS. Aren't you glad I'm going to summarize this for you? Just the title is a mouthful, right? So before I really dive into this paper, a little bit of background information on why vaccines with these therapies are a problem, and how some of these papers aren't going to give you the full picture. The immune system is insanely complicated. The more you learn about it, the more you recognize that. So take this with a grain of salt, because I'm going to very, very much simplify it and probably oversimplify it for us for the sake of this discussion. But the immune system has two halves. There's the T cell half and there's the B cell half. Ocrevus, Rituxan, Kesimpta, they do not really affect the T cell half. They affect the B cell half. And they don't take out the entire B cell half. They're not like a heavy duty chemotherapy that wipes it out. They take out a tiny sliver of it that is the part in the B cell life cycle that's basically in the middle when they're teenagers. So it leaves the baby B cells intact so you can form new immunity. It leaves the adult B cells intact so you can remember all your old vaccines and your old infections. That's what protects you in the long run. And it really just takes out the teenagers, which are the ones that tend to go and cause the trouble that then becomes MS, right? So it's like a little smart bomb. It goes in and it takes out just the problem makers and it leaves everybody else okay. And that's the reason we need to redose these medications, because those cells grow up after a few months, right? The babies grow up into the teenagers, and we need to start all over again and take the teenagers out. So not advocating killing teenagers, by the way, right? Metaphor for B cells and for immunity. So that's how these medications work. They take out that part of the B cell life cycle. But we need our B cells to form immunity to vaccines, right? So that's why we're a little bit weakened in the response to vaccines, because we've taken out those cells. Again, it leaves the T cell half of the story completely intact. It takes down the B cell response a little bit or a lot, depending on who you are. And the studies that we're going to talk about mainly measure the B cell response to the vaccines. This is the test that you can go and get. It's commercially available. It's the antibody test that people are talking about. The antibodies are the product of the B cell half of the immune system. We can very rarely measure the T cell half of the immune system. It's really only done in an immunology lab. Even then, it's very expensive and very hard to do well. Two of the papers that we're going to talk about measure the T cell response, which is very interesting because, again, we don't usually get to do that. But if you're going to go out there and just get a blood test to see if your COVID vaccine worked, I don't know why I said quotations. It is a blood test to see if your COVID vaccine worked. What they're going to do is they're going to measure the B cell half of the story. They're going to measure the antibodies. So some of my patients have done this and they come back and they're getting like a 0. It looks like they've never been vaccinated. It's nothing. There's no antibodies to COVID vaccine, even though they've had the full vaccine course. And this can be a little bit scary for them, right? Because they're like, well, I thought I was protected. It turns out I don't have any antibodies. It's almost like I never got vaccinated at all. And I remind them that this test is not measuring the T cell half of their immune system, which is the normal half, right? The Ocrevus, whatever medication they're on, one of these 3 meds, is not affecting the T cell half of the story. It just happens to be the half that we can't easily measure, okay? So take that with a grain of salt. If you're on one of these medications, you got an antibody test and it was negative or 0, we're not measuring a whole half of your immune system here with the T cell half, okay? So that said, this paper only measured the B cells, and it looked at people who had gotten the Pfizer vaccine only, both doses. And I think this had the highest number of patients of all the studies we're going to talk about, and it's only 60 people, okay? So we're talking about very, very small studies here. So what they did is basically they looked at the B cell response, the antibody blood level in people with MS who were on, I believe it was just ocrelizumab. Who did this look at? Yes, just ocrelizumab, adults over 18 years treated with ocrelizumab who got the Pfizer vaccine. And they looked at just the B cell response after the first vaccine dose. They did it at baseline before they got vaccinated. And none of these people had antibodies to COVID. 1 out of the 60 had COVID, but they had no measurable response to it, probably because they were on ocrelizumab. So they didn't have any antibodies. It's like none of them had ever been exposed to COVID. We just know that one of them had because it had a positive PCR test in the past. But everybody started out as 0 antibodies. And they looked at the response after the first vaccine dose. They measured the response then after 2 to 4 weeks after the second vaccine dose also. So that's kind of interesting because we're going to talk about what they saw and the difference between those responses. Again, all Ocrevus, only measuring the B-cell response. So what they saw is, and then the other thing that they did is they looked at the B-cell levels in these people at the beginning of the study. So 57 out of 60 had no measurable anti-CD20 B cells, which are the ones that are affected by Ocrevus. So in essence, the Ocrevus was working really well. In 57 out of 60 of these folks, it was doing its job. And the other 3, I don't know what was going on. What they saw is that, the percent of people who had a response to the vaccine, and keep in mind in the regular population, it's like almost 100%. The percent of people that had a response to the vaccine after the first dose was only 13.5%. And after the second dose, another 21.6% converted. So we're talking about like mid-30s of the percentage of people who developed antibodies who were on ocrelizumab. Again, in the general population, this would be close to 100%. So a huge decrease in people who have a B-cell or antibody response to the COVID vaccine who are on Ocrevus. There is a big jump between people who had a response after the first vaccine dose and people who had a response after the second vaccine dose. Of all the people who had a response, over 60% developed it only after the second dose. And so what they say, what they suggest in this paper and what we're doing now is telling people on these medications to get a 3rd dose of the vaccine. Because you can imagine if we had a little bit of people, some people responding after the first dose, more people responding after the second dose, we would likely have even more people responding after the 3rd dose. So that was kind of the big takeaway. One of the other things that they measured or that they saw is that, was it this one? That there wasn't a big difference between the timing. So one of the things we advise our patients on is, hey, don't get it right after your Ocrevus infusion, wait a few months, because other studies have shown that the longer you wait after your infusion, the higher chance you have of responding to these vaccines, because those B cells are starting to come back a little bit. Even if the level is so low, we can barely measure it or can't measure it at all. And this study found that it didn't really, that didn't really happen. They didn't find that the duration since the last Ocrevus infusion or the kind of interval between Ocrevus and vaccine helped to get a bigger vaccine response. So that was puzzling because that's not what we've seen in other studies, and that's not how we advise our patients. So they didn't say that it hurt, right? It can't hurt to wait if you are able to, but they didn't really see a big difference, which was really interesting about the study. So limitations, this one did not look at that T cell half of the story, right? It only looked at the B cell half, and they say that this is really not telling the full story, but this is telling part of it, and it jives with what we thought, which is that the COVID vaccine limits our B cell or antibody response quite a bit. All right, next study. We're going down in numbers. This is 49 patients. So this is the JAMA Neurology paper, obviously a good journal, humoral T cell responses to SARS-CoV-2 vaccination in patients with multiple sclerosis treated with ocrelizumab. Again, an Ocrevus study, but I don't see why this can't be tangentially at least applied to people on Rituxan and Kesimpta. They work the same way. This one again was only Pfizer. So people on Ocrevus who got the Pfizer vaccine, again, only 49 people. So not a huge number and kind of similar to the last one where we saw 60. So this one, the benefit of this one is that they did measure T cells in this one. So we're getting both halves of the story, the B cell and the T cell. But this one, they only measured at baseline, so before vaccination, and then after the second vaccine dose. They measured the B cells 2 to 4 weeks after the second vaccine dose and the T cells 2 to 8 weeks after the second vaccine dose. So this one will not give us the same kind of look that the last paper did at whether there's a difference between response after first dose and second dose. They just kind of looked at people once they were really done with the full course of Pfizer vaccine. So this one has a nice little graphic here that you can see that shows that people, these are people without MS, these are people with MS, but not treated, and these are people with MS who are on Ocrevus, and this is their kind of antibody response. So the interesting thing about this paper is that people with MS who are not treated have similar response to healthy controls. So the MS itself is not a factor here, right? It's just the medication. We're seeing basically that the Ocrevus reduces the response to vaccine, both with the B cells specifically, and then the T cell response here is pretty similar in people who are on Ocrevus and people who are not on Ocrevus. So now we're starting to get that second half of the story, and it is what we thought, in that the people taking Ocrevus should not have a reduction in their T cell response to vaccines, and that is what this paper showed us. The B cells are reduced as we would expect. The T cells are not. They're about the same as people who are not receiving Ocrevus. So then we get into the third study. Congratulations for making it this far. This is a paper out of Nature, Nature Medicine, obviously a fantastic journal. Look at this long list of esteemed immunologists, the senior author being Dr. Amit Bar-Or. And this paper is called Cellular and Humoral Immune Responses Following SARS-CoV-2 mRNA Vaccination in Patients with MS on Anti-CD20 Therapy. Anti-CD20, again, being those 3 medications that we talked about. This looked at people receiving Pfizer or Moderna, and even smaller numbers here. They only had 20 people on medication, and they compared them to 10 controls. But like, look at the gorgeous immunology here, guys. Like, beautiful, beautiful, probably very expensive analyses, because they were looking at the T cell response here. They did B and T cell responses, and they looked at 5 time points. The first one was the timing of the first vaccine dose, which is essentially baseline, right? You're not gonna have anything change right at the time that you get the dose. 10 to 12 days after the first dose, then they looked at the timing exactly of the second vaccine dose, another 10 to 12 days after that, and then the final time point was about a month after the second dose, by which point you should have all the immunity you're gonna get from that vaccine, right? So this paper found that, similar to the other 2 papers, that the B cell response was reduced in people on these medications. And they found that the number of B cells is more important than the duration, since the interval since the last infusion with Ocrevus, right? So the way we practice, the way we tell our patients is, hey, put as much time between your last Ocrevus infusion and your COVID vaccine as you can, with the sweet spot being about 4 to 5 months, so that you have time to finish the immune response cascade before your next Ocrevus infusion. So that's how we typically advise people, although for everybody it's different. And again, I would definitely advise talking to your doctor. But they're saying that, hey, well, we were actually able to measure the B cell numbers, and we found that the number itself was more important than the timing. Not a huge surprise there. We're just not really able to measure the numbers in real time and quickly like they are in a study. So we use the time interval as a proxy for the number of B cells that might be lying around. And the other thing about that is that at least half of their people in the study were even less than 4 months since their last Ocrevus infusion, which, again, is not the way we typically practice. I really wish we'd had higher numbers of people who were a little further out from their Ocrevus infusion. So that was one, and that's, again, similar to the other studies, similar to the way we practice. If you can put a little bit of space between your Ocrevus infusion and your vaccine, you're more likely to get a B cell response, because the B cells are the thing that the Ocrevus is killing. What this paper also showed, because they had that beautiful immunology with the T cells, is something a little bit surprising, but that other papers have started to report too, is that your T cell response, if you're on one of these medications, is not only the same as people who are not receiving the meds, it's actually a little bit better. You're getting more protection from the T cells than people who aren't on these meds at all. Why is that the case? they give a nice immunological explanation that we don't have the time or the energy to go into right now, but it is basically that some of these B cells that the medications are getting rid of are cells that were dampening some of the other T cells, right? So once those B cells are gone, these T cells are free to do whatever they want and provide a more powerful, more robust response to the vaccine on their side of the story. So there you have it. 3 papers just out in the last month that show that people on these anti-CD20 therapies, Ocrevus, Rituxan, Kesimpta, who got the COVID vaccine probably had a limited response to the vaccine as far as the B cell side of their immune system, which is the side that these medications affect. This is also what we can measure using the clinical tests that if you go to any lab and ask for a COVID vaccine blood test to see if the vaccine worked, that's what you're going to get, right? So that's why it looks low. But with the added little caveat here is a little bit of good news in there, in that the T cell half of their immune system, which is intact, is probably protecting them either normally or even maybe a little bit better than normal. So definitely still recommend people get their vaccine. Even if they're on these therapies, you will get protection from COVID from it. Will it be 100% normal compared to what everybody else got? Probably not. No, it'll probably be a little bit diminished. And that's why the 3rd dose is also an important thing to consider if you're on these therapies. So I hope that wasn't too confusing and that you found it useful. Again, one of the most common questions I get, a lot of my patients are struggling with this right now. The next conversation that we usually have is, okay, like how do I apply all this to the way that I live my day-to-day life? Thankfully, case counts in California are going down. So that's some good news here that we can be a little bit less restrictive with our activities. But again, everybody is different. Every immune system is different. Every brain is different. Talk to your doctor. Get their advice, but these are some small studies that are starting to come out that should give us some numbers into how the average population is going to respond to these vaccines.